Good morning, good afternoon, good evening, and welcome to the very first IASP Town Hall meeting. I'm Greg Carbonetti, IASP's Associate Director of Publications, and today I have the opportunity to facilitate a conversation between our volunteer leaders and Andrew Rice, IASP's President, alongside Steve Gardner, IASP's Chief Executive Officer. At this time, I'd like to introduce Andrew Rice and Steve Gardner. Andrew Rice is Professor of Pain Research at Imperial College London and an honorary consultant in pain medicine at Chelsea and Westminster Hospital in the UK. He is active in both clinical practice and translational research elucidating neuropathic pain. His research covers both laboratory and clinical research spanning animal models, through deep profiling of patients with a view to personalized medicine, to clinical trials and evidence synthesis by meta-analysis. Next, I'd like to introduce Steve Gardner, who's spent his career working in and consulting to associations in Washington, D.C. in the States, having previously served as an interim executive for several organizations, notably the American Chemistry Council, the National Association of Broadcasts, the American Academy of PAs, and the International Safety Equipment Association. Steve's been with IASP in his current capacity now since December of 2023. With that, I know that Andrew and Steve want to share a few thoughts before we open the floor to all of your questions and comments. So now I'll throw over to Andrew and Steve, and I think Andrew's going to lead us off. So happy to be here today, Andrew.
Welcome, everybody, to our first town hall. As Greg says, this is the first of a series of town halls, and really it's your chance to ask us absolutely anything about IASP and its direction and processes. I just want to highlight three of the things that we're doing, especially this year, that I've mentioned before. But we have two presidential task forces. One is around environmental sustainability and pain research, education and management. And the other is to redesign our animal guidelines, animal research guidelines that were last published 41 years ago and obviously in need of updating, although they remain one of the most highly cited papers from pain. And then I'm also very excited about next year's Global Year, which will be on pain management, education and research in low middle income settings. And although the emphasis will be on low middle income countries, the word settings has been deliberately chosen to include disadvantaged populations in high-income economies as well. And then we've got a number of other activities. We're taking the 50-year opportunity to have a closer look at how we design and deliver our World Congress. And we're also taking a look at our membership structure. And I think Steve may tell you a little bit more about that. Great to see you all, and thank you for attending.
First, a little bit about what we're doing today and why. So I've heard since I've come on, and the executive committee and the council have both stressed this to me, and I've seen this in comments in other places, that people want more transparency from IASP, how the decisions get made, how does IASP deliberate on topics, and what it's generally is happening at IASP. So this is our first attempt to reach out and be more transparent, take questions, hear about your concerns, and make sure that we're taking them into account as IASP deliberates on all of the many topics that the council addresses and looks at. You, for this call, have been chosen because you are what we consider, or what I'm loosely coining, the leadership network. We have the early career network, and everyone who was invited to this call and the one this afternoon was invited because you are in IASP leadership in some capacity. You are leading or a member of a task force, a committee, a work group, the early career network. You're all in a position to see parts of IASP, but not necessarily all of it. And importantly, you're the forward-facing part of IASP, interacting with other members and leading very important topics that IASP is deliberating from time to time, whether you're on grants and awards or you're with a SIG. All of these things come together at IASP, but we realized there wasn't a forum for you to talk to each other or hear common issues of concern that you might have. So that's what we're doing here today. That's what this first town hall is about. We will expand town halls and reach out to the entire membership for future town hall meetings to get whatever questions or concerns are on the broad membership's minds. But we will frequently, or from time to time, invite this leadership network of people who are more closely aligned with ISP and volunteering on specific topics to come into a town hall and express your concerns or share whatever you would like to share with the others who are in the leadership network. So that's what we're doing today. That's the concept behind this, and why we are having this town hall. I do want to show one quick slide just to orient everybody. This is the team in front of you, and we have some of those folks on the call today, including Angelo here because of his role with SIGs. Angelo is the main point of contact for SIGs. On this chart, you see that Latoya and Tracy are part of the executive office. Angelo, Nicholas, and Blake. There's no picture for Blake, but he's on there. But this is the marketing and membership team. So anybody who has questions about marketing, membership, SIGs, go here. Sarah and Kayla are our business development team. So anything that comes up with working with potential partners, grants, awards, those kinds of grants, those things. Heather and Sarah are education. They do a lot of work organizing the educational content with the membership for Congress, but also putting up our webinars and other things that we may need to disseminate for educational purposes. At the bottom, Greg, Peter, and Renee are our publications team, and they do manage the journals, but also PRF, and Greg pinch hits on a lot of webinars for the organization. And at the bottom here is Anne. Anne is our contractor, but she does meetings and events, and she was the primary organizer for Congress. So this is the team, and I just wanted to start off with a little data point there to show you who is in the office, what our roles are, and who you can reach out to if you have a question. So just with that little bit of background, Greg, I think we can go ahead and open it up for questions and whatever topics that the attendees today would like to bring up.
We've got our first Q&A here. So this is actually coming from Kai Kairos. I'm going to be pulling double duty today, engaging a little bit, asking questions. So I hope everybody can provide me a bit of their patience as I work through the questions as they come in. So Steve and Andrew, Kai sent our first question along today, and it reads, as a board member of the social aspects of pain SIG, we and our board members would love to see an increase in access and representation of people who are commonly not a part of IASP or the World Congress on Pain. Examples would be people with lived experiences, people from lower SES communities, people from local communities, etc. As an example, other conferences explicitly promote inclusion of non-academics or people with the lived experience in their scientific program. Is this a topic that is also on IASP's radar? And what are some specific steps that can be taken in that direction, especially considering the location of our next World Congress being in Bangkok? And he also wanted to express a word of thanks for putting this town hall together. So essentially, are we looking at ways, or what are some direct pathways that we can be more inclusive of non-academics or people with the lived experience of pain, both as an organization, but also on the ground at forthcoming meetings? Andrew, Steve, anybody want to jump in?
Thank you, Kai. Something that's very much on our agenda and has been for a few years. In fact, Claudia Sommer really set up initiatives in this area. We really must hear the voice of lived experience within our community, and we're very active on that. For the past few presidential cycles, we gradually introduced lived experience voices on most of our important task forces and working groups. For example, we now have lived experience people on the Scientific Program Committee of the World Congress. They're represented and a very important representative on, for example, the Cannabis Task Force that we had a few years ago. As for more formal integration, we set up GAPA probably about 4 years ago. Actually integrating that into ISP has been quite complicated, but it's, I would say, one of the highest things on Steve agendas to actually get that up and going and to discover what the precise model will be that suits all of the stakeholders in that. So it's certainly on the agenda, and I'll pass over to Steve about his comments about how we integrate it more into ISP's everyday existence.
ISP wasn't doing a very good job of integrating GAPA into its functions, and GAPA went into abeyance for almost a year. And we have basically relaunched GAPA in the last few months. We started having meetings again before Congress, and we're now on a sort of a monthly cadence with GAPA to sort of relaunch that function. What we're focusing on is how to increase the number of members of GAPA. So that would get to your issue about more people. Right now, GAPA is essentially a task force with 15 to 20 people who participate, who share their thoughts on people with lived experience. And there wasn't really a formal mechanism to nominate people from GAPA into the various committees and task forces and so on while they were in advance. And now that we're relaunching them, we're still not quite ready to start soliciting GAPA for participation in all the committees and task forces that we have, but it's coming soon. And we're working through those issues with them. I mean, a lot of the people who are part of GAPA are volunteers who, give their time and have day jobs like all of you do. And so finding the right amount of time, the right number of projects, which things do they want to engage on, because almost all of the committees and task force would like to have their input, but that would stretch them pretty thin. So they're prioritizing which functions they would like to spend most of their time in. The scientific program has been one of them. There will be others, but they are sort of assessing where do they want to lend their expertise and where do they think they can provide the most value to IASP. So that's kind of where GAPA is now, but there will be a presentation at our council meeting in February where we will talk about how to increase the number of people participating in GAPA and how we can better utilize them across all of our various groups.
Perhaps I can throw a question to Steve and Andrew right now. Having had an opportunity to been around the organization and see some of the successes and challenges that we've had, I'm interested to ask from Steve's perspective, having been able to join IASP now in your capacity for almost a full year. What's something that you've viewed as a success over the last year at IASP, Steve? Something that when you think about puts a smile on your face, lets you know that we're moving in the right direction, or likewise, if you didn't maybe want to necessarily focus on a particular success, what's something that you view as an opportunity or something that the organization might be interested in moving toward that can help us achieve our mission?
Thanks, Greg. So there are two things, and I neglected to mention them at the top of the call. We have a SIG task force, which is looking at how we manage SIGs and how the finances work in SIGs, and that's a temporary working group to try to figure out how to address this issue. That's really important to the organization. It's really important to the forward success of the organization and how we manage our finances. And then Congress. We have a task force to reimagine Congress. Not every the survey results for Congress are very strong. People enjoy going to Congress, but we think there are a number of things that we could do to make it more economically viable, to address the concerns that do come up in the surveys, and to make sure that we're on the cutting edge of Congress rather than following the trends. And so I'm hoping that this group is going to come forward with some really strong recommendations for how we can improve Congress over the next several cycles of that. So that's good. And then the other thing that I think is indicative of this call is I just think as an organization, ISP historically hasn't done a very good job of just communicating with membership. And so this is one of our big initiatives to be more visible, to share more information, to be responsive to members. I think just in general, our member communications across the board could be better. And we will do more than just webinars, but I really think that how we communicate with members, get people interested in what's going on at ISP, leverage all of that member energy and enthusiasm for participation. And that's really one of my top goals.
Andrew, as somebody that's been in the space now for many, many years, what are some recent successes over the past year, or something you view as a real opportunity that ISP might be able to explore over the coming months?
I think the opportunity is that we're taking the fact that we're 50 years young this year to really look to the next 50 years. And it's an opportunity to look in detail at many of the things we do. So say we're taking a fundamental look at our membership structure. We've recently reduced the lowest level to $25 so that people from low middle income countries or trainees have more opportunity to join. But I want to reiterate to Steve, our big showcase event is our World Congress. We're taking a very detailed look at that with a special committee, but also Kirsty Bannister, who will be chairing the scientific program, and Sasi Khan, who I think is on the call, who's our local arrangements chair for Bangkok. And there really isn't anything that isn't on the agenda. I would say that we've thought a lot about the playoff between attending both the environmental and financial in person and virtually. And most people sort of seem to say they would like some kind of virtual option, but probably not live. But I think most of the feedback we're getting is that people really value the networking things that come with a World Congress. I'd also say there were two communities that perhaps we're not as engaged with. There's been fall off in the number of basic scientists attending the World Congress and presenting there. And we're spending a lot of time thinking about that, what we can do to offer them. We're also conscious that those of our clinical colleagues who are perhaps on the more interventional end have other congresses they prefer to go to. And we're looking at our congress to see what we can do to make it more attractive, whilst maintaining the fundamental ethos of IASP. That's the important thing. So Congress is the thing we're really thinking about. And really, there's nothing that isn't on the table. But most of the feedback we've had from Amsterdam has been very positive. People like the Congress. My first Congress was in 1990 in Adelaide, and the basic structure remains the same. Plenaries, workshops, and posters. I would reflect that I look back, there were something like 24 plenarists at my first World Congress, and only 2 were women. I think we're now in a much more balanced situation in that regard. But Congress is the big thing we're talking about. And as Steve said, we've evolved over the last 50 years. We're a structure of both chapters and SIGs, and federations sit in between those organizations. So understanding how we can improve on how we interact with our SIGs in particular has been an ongoing task for the past 18 months, and we're fairly near to finalizing that to something that is mutually beneficial to all concerned.
Just as a note, Kai rightly so this is an opportunity to supplement his initial question in that perhaps the inclusion of different voices would help to revitalize the World Congress program as well. And I know that's certainly not lost on the Reimagining Congress Committee. I might be able to give Andrew and Steve just a quick reprieve. I just wanted to touch on Dom's question from a few minutes ago where he asked, is it possible for non-members to attend IASP webinars? And plainly, yes, Dom. All of our webinars are available for non-IASP members. Where there may be some confusion or discrepancies from time to time is when we elect to monetize webinars for non-IASP members. These pertain to webinars that we deem of significant value, or we expect there to be a lot of enthusiasm from folks outside of our membership. Likewise, we often have webinars co-produced by, say, a special interest group and another organization. One that comes to mind was we did a musculoskeletal special interest group webinar last week, which included the Osteoarthritis International Research Society. So there's always a bit of wrinkle to when they're monetized. But again, to your question, yes, IASP webinars can be attended by non-IASP members.
I mean, that is something that we're thinking about. With all these things, there's a trade-off between IASP spending a lot of your resources in delivering something that you as members pay for, with making something free access. And one particular area we're looking at very carefully, and I think Rebecca Seal, the editor-in-chief of Pain Research Forum, is on the line, is particularly how we can redesign Pain Research Forum to that regard. That is currently an open access things. It is a substantial cost to IASP, but it is currently open access. And actually, that's something I would really love people to feedback on how we balance out what IASP is spending its money on and keeping something as a member resource compared to making something open access. and that is a tension that we've spent a lot of time in the last few months talking about. And I think you're going to see quite a few changes at Pain Research Forum for the better.
Andrew actually teed it up quite nicely. Jan asked, it would be very interesting to get an overview of the finances from the World Congress on Pain, especially in the context of what many members viewed as very, very high registration fees. Now, Steve, perhaps you're equipped to answer this question, but essentially, is there a mechanism that members can get a better understanding of what finances look like around our international meetings?
Yes, we need to figure out how to be more transparent about why we charge what we charge and what goes into it. Let me just say, first of all, Amsterdam was a very expensive venue for us. The costs of the facility were very high. Since COVID, most of these venues have been trying to get their money back from the years when they weren't, essentially 2 years, when most of these venues weren't doing a whole lot of business. As a result, venue prices, food and beverage and all of those things are just exorbitant. So we don't make nearly as much money from Congress as we did before COVID. And we've also seen our numbers decline. So the Congress does not have as many attendees as it had at its peak. And so the way the finances work is we have a Congress every other year. The money from Congress basically supplements IASP's budget in the years when there's no Congress. And so that's why there is money that's made from the Congress. The other part of it, so when we went into Amsterdam, the prices were relatively high. They were not that much different than Toronto's prices, but the VAT went from 7% to 21%. So there was basically an additional 14% added to the fee that was just taxes paid to the Netherlands. And so that was a part of why there was a pretty significant price jump. When we go to Bangkok, we go back to a 7% VAT. And so that 14% can come off the total of the registration cost. So we should be able to lower the price in Bangkok, partly because of the venue. The venue will be only slightly cheaper than Amsterdam. I know people believe that Bangkok is very inexpensive, but the venues and the meetings industry, knows what everybody around the world charges, and so it's not as inexpensive as people may believe. And the other part of it is we will have a much lower VAT in Bangkok in 2 years. So there should be some pressure coming down on the prices, but really we're not making a ton of money off of Congress, and it is because how expensive they've gotten, and to be honest, how expensive it was to be in Amsterdam. The other part of it is we could probably get a lower fee and lower our prices in other venues if people would use the Congress hotels. Now, a lot of people that are attending are poster presenters and people who have a slim budget to go attend a meeting at all. So they're going to use Airbnbs and double up and whatever. Well, the lack of use, and that's understandable. People are saving money by using these other rentals, but that's creating a problem where we aren't putting as many people in hotels, so we don't get the price breaks to be able to lower the prices further. So all of this stuff is interrelated, and maybe we should have a separate call at some point about Congress and just talk that through, because it is reflecting how expensive venues have become.
We are very conscious about the registration costs. Steve, correct me if I'm wrong, but I think trainee and lower middle income countries rate, we don't essentially make any money on for the early bird registration. It still ends up quite expensive. The VAT was a nasty surprise in Amsterdam when the rate got hiked. But we argued quite a lot as to what we could do about it. I think the other thing, Yanni, just to bear in mind is that it's becoming increasingly apparent, for the reasons Steve has discussed, to do with COVID and conference centres recouping lost income, that we can't really compare parallel congresses with the registration rates pre-COVID. But if we look at the landscape, other congresses that are similar to ours are not charging vastly different registration fees. But we're very conscious of this in Bangkok. What we would say is that the Congress Centre in Bangkok will be cheaper. We've signed the contract than what we paid in Amsterdam, and it's an excellent venue. But I think what you also have to factor in that hotel prices will be considerably cheaper in Bangkok, and air travel will be cheaper for many of our members who are based in, say, Asia or Australia, who often are the people that have to pay the longer air travels when we're in Europe or North America. And also Bangkok has a lot of air connections, including a number of long distance budget airlines. So hopefully the overall cost of Bangkok will be a lot cheaper. Not hopefully, it will be, but the cost of registration is something we're continually thinking about and trying to bring down and seeing where we can make cost savings. If we were to provide, one of the feedbacks from Congress is that we don't provide a free lunch, for example. But if we did that, then the registration fee would have to go up even higher.
Let me add one more cost pressure. So if you attend a Congress for another event and you see that it is $300 or $400 cheaper than what you're paying IASP, that difference is being made up in what they get for exhibitors and sponsorships. IASP's sponsorship and exhibits have gone down by at least 50%, maybe 60%, because of the lack of blockbuster drugs in the pain world and concern about and new rules for how pharma can interact with organizations like IASP. That's caused a lot of pharmaceutical companies to withdraw from IASP and other organizations as well. So in previous Congresses, you would have, we had $750,000 in exhibit revenue this year. In typical Congress, you would have had $1.5 to $2 million in exhibitor funds, certainly much more than the $750K that we had in Amsterdam. And when those exhibitor revenues go up, you can lower your registration price because you're making up revenue in other places. That's been exceedingly difficult for IASP because of the restrictions, the fears about opioids and the opioid crisis in the United States. So there's all of these different factors that have caused the exhibitor revenue to go down. So if you want to continue to have a Congress without as much exhibitor revenue, you have to pay for it somehow. So that's another part of the equation as well.
Appreciate it, Andrew and Stephen. I'm sure that this is going to be a conversation that continues, especially with some output from the Reimagining Congress Committee, and as we have an opportunity to, have more transparent conversation with our membership. Amanda simply asked, what are the plans for our journals, Pain and Pain Reports? Will their focus or their structure remain the same in the near future? Are we expecting some real transformation in those publications? I certainly have some thoughts myself, but Steve, Andrew, if you guys wanted to jump in, maybe Andrew, do you want to say a few words?
From a sort of administrative point of view, our publishing contract, we will start renegotiating. That comes up for renewal. I think it's next year. Is that right, Greg?
We'll have to make there will be a definitive decision as to whether or not we'll be pursuing a new publishing group about this time next year.
But I think one of the key points I really want to make is that although Pain Reports and Pain, and it's not a journal, but Pain Research Forum is a similar sort of dissemination vehicle and publication, or their editorial independence has to be sacrosanct, and it is. We appoint the editors, but the actual editorial content is a question for the editors, and I think we have to be very hold that in high regard. And I'm just wondering, Greg, actually at one stage whether we might have a town hall with the editors.
I think that would be a fantastic idea, Andrew, because again, there's always the publication landscape changes, a new publishing agreement. There's a lot to be excited about. One thing that always comes top of mind is under our current publishing agreement, when that began, Pain Reports did not have an impact factor. And now that Pain Reports has an impact factor, we've actually seen submissions double since that impact factor was awarded. So there's a lot to be excited about. And I'm sure that Karen Davis, our editor-in-chief of Pain, David Yarnitsky, our editor-in-chief of Pain Reports, as well as Becky Seal from Pain Research Forum, would be thrilled to have an opportunity to connect with everybody. Steve, did you have a few thoughts about the journals? I see a bunch of questions coming in now. I want to make sure that we save enough time for everybody.
No, I think I'd rather get to the more of the questions.
Great. Thank you very much, Amanda. I'm going to move on to David Holloway right now, who admits his bias up front as a chair of the registry SIG. But he asks, is there any interest or intent in other task forces addressing internationally relevant issues like minimum data sets, quality improvement in paying services, et cetera? It seems like an area ISP could play a really transformative role in and materially benefit low and middle income countries who may be trying to set up processes of themselves. Andrew, did you have some thoughts?
A really important point, and it's not an active or hyperactive area of discussion within the executive and council. Judging from your comment, I think maybe it should be. And often our best sort of ideas are either SIG originated or SIG delivered. And of course, that's the function of our SIG. I think one thing we could maybe do is put you in contact with the two co-chairs of next year's Global Year. So that's Sarab Sharma, originally from Nepal, now in Australia, and Margarita Calvo from Chile, to discuss how we may perhaps entertain aspects of that within next year's Global Year. I wonder if, Steve, this is a conversation we might take with the particular SIG, the registrar SIG, and see what ideas they have, because just to emphasize that it's not an active discussion, but it probably should be.
Mohammed had an interesting point, and I think perhaps the answer may be everything's on the table, but it was a question along the lines of Congress layout. Has there been any thought given to, maybe extending into the evenings, cutting down on days, shifting the timeline of Congress to maybe make it a little bit more cost beneficial for folks that might be interested in coming?
It's kind of like it's an intricate puzzle that you've got to sort of figure out, or like a balloon where you push down on one side and the other side goes up, to figure out all of those aspects. So the Congress task force that I mentioned is looking at all of those things, whether or not we should limit the number of days, extend the hours. All of those things are up for discussion. Nothing is left off the table. For Bangkok, we've already signed the contract. So any limitation on days that we would change, we would probably have to do in 2028. It's kind of too late for 2026. But there are some of the things and recommendations that will come out of this group that will affect 2026 in Bangkok, where there's still some wiggle room. But the contract is signed. We have to sign these several years in advance. We're actually kind of late getting the 2028 venue established, but that's because we're waiting for the SIG, the working group, to make some recommendations that will shape where we go with the Congress in 2028. But yeah, we're looking at all of those things, whether we can extend evenings, take time off. But tons of people want to have time at Congress. The SIGs all want meetings. We make a little bit of revenue from some of the hands-on stuff in the cadaver labs, and people like to sign up for those things. So, it is very, very challenging. What do we cut? I think it's interesting that nearly 60%, and I think it's more than 60% of the attendees come to present, whether it's a poster or in a session. We have a very, very high percentage of people who attend Congress who are there presenting relative to other Congresses. And that's because of the price is high, and you can only justify your attendance if you're presenting. That means we have a much larger percentage of people attending to present a poster or something, because that's the only way they can get the attendance paid for. So that is a particular challenge as well. But yeah, all of those things are on the table, and we're looking at all of those potential changes to Congress to figure out where we can save money.
I see that we are getting close to time, and we've got one more question in the queue right now. So I'm going to go ahead and ask Kai's final question, but also, solicit, all of our volunteer leaders in the audience that, although this town hall is going to be coming to an end very shortly, these conversations don't need to end, and we're committed to keeping them going. So if you've got a question that comes top of mind after we conclude today, please don't hesitate to shoot IASP an email, be it myself, the desk, Angelo, anyone that might come top of mind. With that, Kai's asked a pretty selfless question here. I think it might be a good place for us to wrap today. It's simply, is there something the folks in attendance today, they being, those in leadership positions with IASP, is there something that they can be doing right now to help IASP with its current challenges, or anything that they can be doing in their day-to-day work that elevates what they do to help us address some of the issues on the horizon? Anything that comes top of mind, Steve or Andrew? I mean, I know I always love working with the volunteers because they what make this a rich place. But I'll leave my feelings aside and throw to you what you think can be done.
One is, just by having this call, I want you to feel like you're armed with information to speak positively about IASP. You are essentially IASP's ambassadors into the membership because you interact with other members and you're in a position where you are volunteering in some capacity to help ISP move forward. So just by having these meetings, I want you to feel in touch, engaged, and so that you can speak positively about ISP. And, you know, as people ask questions about should they become a member, you have that information. But we need to do a better job of sort of activating you and telling you what we want to promote or what we think is important that's happening at ISP, because, you know, we want the multiplier effect where we want, you know, good conversations about ISP and what's happening there. And we do that through more communications and more transparency so that people feel confident that when they're saying ISP is a good place to join, it's because it comes from a good place. It comes from engagement and awareness and understanding about how ISP is trying to move forward. So that's the point I'd like to make there.
I concur with Steve. I mean, we want to give you a couple of examples. We want to give you resources which you can use to promote ISP. So we're going to be much more proactive in the outputs of, for example, our task forces. And we've actually put metrics in place to see how effective they are. And also one of the major things we do is to translate our resources, for example, our global year fact sheets into other languages, and that's something. But there's two other questions I would really quite like to address very quickly if possible. One is from David Finn, and the other is from Telesfori. I hope I've got the name right. Is there any way to help volunteers from sub-Saharan Africa to ISP through organisation? Yes. And this is something we're being very proactive. Our next year is going to be low and middle income settings, but in February we will hold our first African pain camp, which we're very, very excited about, and we hope for a lot to come out of that. And I'm sorry, I'm having to give very quick answers to David Finn's point about how aggressively should we approach the sponsors and exhibitors from the med tech sector. Yes, Sarah Wheeler is on our call, our Director of Business Development. She's very active in that area. We did have some tech exhibitors in Amsterdam, but also in relation to that, one of the things we're doing at our 50-year anniversary is we're having a discussion in council next February at our meeting exactly about how we interact with industry and industry sponsorship for the next 50 years or so. So the answer to both of those questions is in the affirmative, and I'm particularly excited about Africa. If you look at the map of ISP chapters, sub-Saharan Africa, apart from South Africa and Kenya and Nigeria, are really places we don't have chapters, and I will be putting a lot of effort into improving that situation over the next few years.
David had another point here. Philanthropic funding could be worthwhile to pursue as well. How do you feel about that, Andrew or Steve? I don't think that you agree.
Absolutely, that is one of the areas we're most active in. We're going to completely change our game there. We probably haven't tapped into philanthropic requests and donations from members. And we have a specific task force chaired by Lars Aaron Nielsen, a past president, and Mary Heinricher, looking at exactly that. And I think you'll see a lot of changes in that area over the next few years. Steve, I don't know whether you've got a comment on that.
That group is now a permanent committee. We're calling it the donor committee, but it is entirely set up for how we pursue philanthropic funding, whether through grants or individuals who have the resources to donate, or bequests as people think about putting ISP in their wills. We have several people who, over the years, who have asked how they can leave money to ISP in their will. So that is a stepped up effort from ISP, and we are definitely pursuing that area.
I think I'm going to get ready to wrap us here, Andrew and Steve, but did either of you have any parting words you'd like to share?
Just thank you. We've got a lot of people attending, and I'm thrilled that people were able to.
Yeah, we're excited about this. We are going to, this is not the only time this is happening. Obviously, we have another one scheduled later today to allow for people in different time zones to participate. Nothing, if you have more questions, nothing prevents you from participating again later today if you want to. But this is going to be a conversation. We're going to do this regularly. I don't know if it'll be quarterly or what the cadence of this will be, but you are a very important part of IASP. By being a volunteer leader, you are helping IASP survive and thrive. And so we really have to be engaged with you. We really have to be putting information in front of you and giving you a good look under the hood of IASP, so you're feeling confident about all of the time that you're donating and giving to IASP. It's really important for IASP's success. So this is a conversation. This is the first one, the first opportunity, but there will be many more. So I appreciate everybody taking time to be here today.
I'll bring us home then. So as Steve and Andrew have rightly put, we've come to the conclusion of our very first IASP Town Hall meeting. I want to take this opportunity to once again thank Andrew and Steve, and of course all of you for being here today. Furthermore, I'd also like to thank Angelo Baselli for his help coordinating the town halls today. As Steve mentioned, this is the first of what we hope are many town hall meetings that we plan to hold as an organization, and we'll obviously be sure to pass along information about those convenings as it becomes available. Thank you all so much for participating today, and be in touch. We'll chat soon. All the best.
Thanks, everyone. Thanks for being here. So let's first of all talk about why you were invited and what the purpose of today's town hall is. So all of you were invited because you have some kind of leadership role at IASP. There are members of the council and executive committee on this call, but everybody on this call either is leading or part of a task force, a working group, a SIG, or a committee. And so you are an incredibly important part of the organization. And we see all of you as leaders within IASP, and we've sort of coined the term. We have Early Career Network. We think of you as the leadership network because you're all giving of your time and your energy to support IASP. And so, as we've been hearing that there's a need for more transparency, more understanding of our IASP decision making, more just better communications with our membership in general. And so this is our first step in that process, to have town hall meetings with people who are in leadership roles at IASP. And we will expand the town hall concept to chapters and federations, as well as open it up to the entire membership. But being such an important part of IASP, we really wanted to start with you because you are already deeply engaged with IASP and working with us. And it sort of is a little bit of a cute PR term, but essentially you are our ambassadors. You're the people that others may turn to for opinions about IASP, or whether that they should join, or what's happening in the organization. And I think IASP can do a lot better job of keeping you informed about what's going on in the organization, why we're making the decisions that we are. And then that just makes you more effective in your committee or your task force, or when you get random questions from others who want to understand IASP. So that's the real purpose of today.
I've come ready with a few questions myself that I thought maybe I could throw to Steve and Andrew as everyone preps with questions of their own. And I'd start really simply with Steve and Andrew. Maybe we'll go to you first, Andrew. As we look back at 2024 and obviously moving into 2025, what sticks out to you as a real success for the organization this year? And likewise, or perhaps inversely, what do you see as some challenges that are coming on the horizon, and ways we can envision getting through those as an organization?
I think a success is that we're still here after 50 years and thriving and doing well. In fact, this afternoon, I was asked to look through the ISP's archives of photographs for all our World Congresses going back, and that just reminded me a lot about the history of our organization. One of the things we're doing is taking the opportunity of being 50 years old to really reassess some of the fundamental aspects of what we do and see if we can do them better or make them more fit for purpose for the next 50 years. And probably the most important of those is a task force chaired by Michelle Sterling, who's our ISP secretary and also chaired the Scientific Program Committee in Amsterdam, just to really take a deep look at how we do Congress. We're calling it Reimaginating Congress. Now, it may be that we changed nothing, or it may be that we changed a substantial amount. And we're very grateful for the feedback we got from Amsterdam. So we're taking a very deep look at Congress. We're also taking a deep look at our membership structure. We've already reduced the lowest membership category to $25. Quite a live question at the moment is how people with lived experience can provide input and access ISP membership. So those are two aspects we're taking a very deep look at as we move forward. But I'm sure Steve's got some things as well he would like to add to that.
One of the things IASP could have done better and needs to do better in the future is things like this, which is communications with our members. Two-way dialogue, the opportunity to give feedback to IASP, tell us what you like, what you don't like, and be candid with us about that. I think, criticisms valid about more transparency and more openness is something that we take seriously and are working to facilitate. I mean, I think for me in my first year in this role, a lot of it was getting up to speed on things that we're doing, figuring out Congress, figuring out budgets, figuring out how the team can come together and work best. And part of the things we've got planned in the future is a revised or new strategic plan, and a couple of other things that are also in the works, reviving GAPA so that we have more people with lived experience integrated with ISP, a task force that's looking at SIGs to make sure that the SIGs are functioning appropriately. We've had some challenges in organizing around SIG finances and so forth. And so we're working to figure those things out. And this year, with Catherine and then transitioning to Andrew, I love Andrew's phrase, grasping the nettle. And I feel like few instances we're grasping the nettle to make sure that we're taking on some of the tough challenges by ISP and not sort of sidestepping any of those. So, I think that's how I think Andrew and I and the executive committee have taken this challenge is, let's put everything on the table. Let's fix what's not working. Let's not be afraid to make changes if we need to.
I'm going to take your advice and grab the nettle myself. Again, by all means, if anybody has any questions, please feel free to throw them into the chat or use Zoom's Q&A functionality. We had an opportunity to convene this morning, a few hours ago. We've had 2 town halls today in an attempt to accommodate our international membership. And something that was a big topic of conversation during our meeting this morning surrounded transparency as it pertains in this particular instance to finances for our past World Congress and the World Congress that's coming up, especially in the context of, if we just call it like it is, higher registration fees and some of the things that went into that. I'm curious, Steve, if you wouldn't mind, can you speak a bit towards how Congress went in Amsterdam and how we're putting things under the microscope as we start to prepare for Bangkok in 2026?
We talked a lot about Congress in the session that was earlier today. And some of the questions that kicked that off were around the fee. People being concerned that the price of Congress is really very high and prohibitive for some to be able to attend. There are a couple reasons for that. One is that venues are charging a lot more money. They were all hit very hard during COVID when people could not travel and could not gather. And so they're essentially trying to make up this money. And so the costs are very, very high. So that's a big part of the fees. The other thing was in going to Amsterdam, in Toronto, we paid a 7% VAT, and in Amsterdam, it went up to 21%. So the fees for the 2 congresses were actually fairly similar in terms of what IASP took in. There was a very small increase to cover some CME costs, but largely it was the difference in taxes that amounted for the largest amount of the increase. And in Thailand, in Bangkok in 2026, we go back down to a 7% VAT. So we should actually be able to lower prices for Bangkok. That's a big part. The other part of it is how exhibitors have fallen off over the last several years, indicative of both the pharmaceutical industry and just congresses in general. When you go to a congress and you pay, $300 or $400 less than what you're paying at IASP in some cases, and you're getting lunch and you're getting breakfast, and you're like, well, why am I paying so much at IASP and I'm not getting any of that? It's because of the exhibitors and the sponsorship levels have declined. And when those other congresses are able to offer lower prices and more amenities, it's because that financial gap is being made up with large sponsors and exhibitors who are paying a lot of money. We had roughly $750,000 in sponsorship exhibits and exhibits to offset the cost at the Congress. I talked to another CEO who runs a similarly sized Congress. They get in excess of $2 million in exhibitors and sponsorships. And so they have a lower price, they offer more meals, all that kind of stuff. But this is largely driven by the American opioid crisis and a lack of blockbuster drugs in pharma. And so we've seen that sponsorship revenue decline. So that's kind of the push and the pull of the economics around Congress.
I really appreciate it, Steve. We actually had somebody ask an anonymous question, which is absolutely fine, by all means, in whichever fashion you feel comfortable asking. But as a point of clarity, again, they spoke towards, the cost prohibitive nature. In this particular instance, it was greater than $1,400 for them. But again, as a point of clarity to the thoughts that you provided, we would say that the big ticket items that kind of led us to that situation were an increase in VAT, lack of exhibitors, or fewer exhibitors than perhaps in previous iterations for a multitude of reasons, as well as cost fluctuations as it pertained to coming out of the pandemic. Is that fair to say, Steve? Is there anything else missing from that could have led to some of these higher rates?
Well, I mean, I think the other thing is we've had a decrease in attendance. So we're renting facilities. You have to pay for these. You have to sign contracts for these facilities years in advance, and we've had a decline in overall attendance, which we hope will rebound in Bangkok. A lot of it has been COVID driven and people not completely getting back into the swing of traveling. The fact of the matter is that it's just become prohibitively expensive.
Just speaking towards, there were a lot of factors that went into the high registration rates this year, and it's certainly something, and not to put words in your mouth, but perhaps Andrew can reiterate again with this Reimagining Congress committee. Everything's on the table right now. Is that correct, Andrew?
Yes. I mean, there's nothing we're not discussing. One of the trade-offs we have to make is how much people want to attend a Congress in person and how much they would prefer to view recordings of the Congress. So I think we probably wouldn't go to a fully virtual or hybrid option because that is unbelievably expensive to do that to a quality level. But certainly, and one of the feedbacks we're getting and certainly had from the Congress is that people really value the networking and personal contact that they have at an in-person Congress. I think one of the things I'd like to reinforce from Steve is that the cost was very high this year. Just to emphasize, ISP don't make any surplus out of the early bird and registration rates for both trainees. And a lot of our attendees are trainees presenting posters or for people from lower middle income countries. And in fact, we have quite a generous amount of grants for those. And that is, of course, rolled back into the overall Congress cost for other people. I think what is probably not valid at the moment is to compare the same Congress pre and post-COVID registration rates. Rather, we're looking at our peer Congress, and they are having the same dilemmas because the Congress centers at the moment are recouping their losses from COVID. And what I can tell you is that the venue cost for a very good venue in Bangkok will be considerably less than we paid in Bangkok. And as Steve pointed out, we won't be hit with such a high value-added tax, which was an unpleasant surprise for us. And the other thing to remember in Bangkok for the overall package is that we anticipate the hotel costs will be considerably lower. And also for at least our members in Australasia and Asia, they won't have to travel as far as they did, so the flight costs will be less. For others, the flight distance will be longer, but one of the reasons we chose Bangkok is it has a lot of airlines competing for space there, so the costs of travel will be considerably lower by then. But we're absolutely switched on to this cost issue of registration costs, and we want to bring them down. That's what I can tell you. It's a complex matrix as well.
So I'd like to throw a few more questions out, and then we can return back to this Congress conversation. We have one here from Johan Blayen, who's been very patient and understands that I'm very susceptible to flattery. Thank you, Johan. Johan asked, as a general question, how do you see the role of IASP in relation to the national chapters? There's considerable overlap sometimes in terms of the education guideline sets, etc. Effectively, how can ISP complement the objectives of its national chapters? And any thoughts you'd like to share here would be great. Andrew, do you want to dive in first?
Yeah, I mean, it's complicated because we are made up of our chapters, but we're not a federation of chapters. So the chapters function independently. And one of the things we like to do is produce materials that Congress, that the individual chapters can use. So we know our global years are very successful in a number of chapters use that to set their theme for their annual scientific meetings. I think Steve can probably better address that we're making quite a lot of efforts to improve communications in both directions with our chapters at the moment. And I think that's one of the major items. One other point is the chapters have always been many of them have been very active in the past in translating, for example, the global year fact sheets into their languages. And we know that's been a popular activity.
I was a little surprised when I took this job and found that we have such loose relationships with the chapters. And I think it's really about IASP figuring out ways to add value to the chapters. So I know they have their objectives, and I think in the areas of advocacy, there are areas where we can perhaps help by setting some more global policy and having more policy making in the Global Advocacy Working Group. And I don't mean lobbying, I don't mean anything like that, but I mean more statements about public policy, public health, access to either medication or increased research dollars, things like that, where we can have a stronger voice and have that help chapters. But I think there are other basic office functions we could potentially offer, like maybe access to membership data, to a membership database system, so that we could help them track their members and that sort of thing. So I think we have to approach it from a perspective of how can we add value to the chapters.
All right, we're keep moving along our queue here. And I see that Stephen Gilbert's been waiting for a while. Andrew, I'm going to ask you to field this one. I am very, very interested to hear what you might have to offer. But obviously, this is in the context of ISP as an organization. And Stephen asked, how can we embed pain management in undergraduate education and in public health with the aim of better and more evidence-based pain management in primary care in the community? Maybe even in the specialist pain management services too. A lot to unpack, Andrew, but is there something that we can be doing as an organization to kind of step into this space more? I understand that there's a lot that goes into that.
I mean, Stephen, this is something actually I've been railing against today in my own institution, that it's very difficult to understand why we have so little pain management training on pain science training in our undergraduate curriculum. We should take that back to the education committee, actually, because it's a big, and get back to you, Stephen. But one thing we do is we produce a core curriculum. And I think that's a valuable thing. It's a while since our core curriculum was updated, and we possibly need to address that. So we'll take that back to the education committee, and Greg, if you can make a note. There's actually 3 points about Congress. I wonder if I could take them together.
Sure,
actually 4 points. Would that be okay?
Absolutely.
So how is the country chosen for each Congress? Generally, we do that in a cyclical way. So it is North America, Europe, rest of the world. There's no set rule for that, but that's the way we tend to do it. We look at a huge number of factors, but particularly cost of the venues, accessibility, air accessibility, and then council. Look at a short list of venues that the staff join up, and we vote on them. But we basically look at those factors. For the Toronto Congress, the online access was frustrating, and we certainly did acknowledge it, and we were certainly very aware of it. And there were a lot of failings on the part of our third-party provider for that. I think the lesson we learned from that trying to provide live access to congresses, if it's done well, is very, very, very expensive, and that would put up considerably our registration fees. So what we're currently looking at for Bangkok, and you'll just notice that many of the recordings for Amsterdam have just gone live, is recording certainly the plenaries and the majority of workshops, and putting those out as recordings. So if you like, that's the virtual component. But unless you feed back to us that there's a way we can do the live Congress recordings in a way that is sustainable economically, we probably won't go back to that. Certainly that's not the feedback we're getting. Is it possible to move it back to every 3 years? That is definitely on the table for the Reimagining Congress Task Force. At the moment, I would say we're probably more likely to stick to 2 years, but there are many pros and cons, and the task force and then Congress Council will look at that very carefully. Basic science meetings, a decent number of exhibitors, e.g. SFN. I've just been to SFN with Heather Hodge, our programs director, and discussed it with Sarah Wheeler. We've engaged with a large number of exhibitors there, particularly for the basic science area. Whether they will exhibit in Bangkok or not, because Asia is often not their core community. So at the moment, I'll be actually in trying to engage with a number of the Asian companies or Asian branches of international companies, exactly that in mind. So we've been very proactive on that.
Again, we're recording today. If anybody would like to follow up with anybody on our panel or with the IASP desk, if you have additional questions following our meeting today, please don't ever hesitate to do so. If it's okay with you, Andrew, I see that Felicia Cox has a two-parter here. Perhaps I can throw the first half of this question over to Steve right now. And Felicia had asked, what do you see as ISP's relationship with EFIC going forward? Obviously there's a very large overlap across active SIG members and committee members over at EFIC. Just curious if you could speak to the relationship between both organizations, Steve.
There have been in the past some strain between IASP and EFIC, and we're working very hard to put the relationship on a good footing. I have monthly phone calls with EFIC, with Sam, who's their executive director, and we are working on building, I think, a very good relationship, and we keep each other much better informed about what each other is doing, what particular challenges we're facing, and how we can collaborate. In January, there is a meeting in Glasgow that I will go to that is a meeting of similar associations that put on global meetings. They get together and they share best practices. And Sam is going to come to that, join me for that. And he and I are going to spend a day or two talking through collaborations with EFIC and how we can strengthen our relationship and how we can find joint projects. So I do think that when it comes to content development, like is in this question that Felicia asked, I do think between ISP and the federations or chapters who are particularly active, we could do a lot more sharing of content and not duplicating content to be able to, we're all part of the IASP family. We should be able to figure out how to leverage the content of each other, market for each other, and just generally support the financial goals of each other. So I think we're on that path, but we've still got a little bit of work to do there. But I think everybody is working with good intentions and working hard to make sure that we're as collaborative as possible.
Felicia, in the second half of her question, pointed out a potential collaboration on the core curricula between our organizations as a potential path forward. But obviously that speaks a lot towards some of the thoughts that Steve shared. Love to hear your thoughts as it pertains to the relationship between these organizations, Andrew.
Basically want to echo what Steve says. In the past, the relationship between EFIC and ISP was not as good as it could have been. And the past couple of presidents of both organizations and their CEOs have been working a lot to improve that, and I think we've come a long way, and it's great to see Esther. And by the way, congratulations, Esther, on being the president-elect of EFIC. There's no doubt that the EFIC education offering is of extremely high quality, and that has taken many years to put together. And having been the liaison representative to our Southeast Asian and now South Asian federations, I would like to echo Steve's point that what we need to work on is ensuring how we can share that excellence and also what ISP offer on the educational level across our different federations and assist them to make that more globalized. And that is something that has been very much on my mind. I think Esther and I have already discussed this in part, and that's something we very much want to move forward with. The link to diplomas is a lot more complicated and something we would need to take on another day.
We've got 2 questions in the queue right now, and somebody's submitted anonymously that they feel that the next decades of ISP needs to focus on publish engagement. We need to start democratizing, decentralizing pain-related materials and knowledge that that IASP produces with the general public. I'll leave it to you guys to decide who might want to take this question first. But essentially, are considerations underway for how we can start to more widely disseminate some of the work that we do? I'd imagine, especially with the context for lower middle income countries as well. Andrew, I see you're unmuted. Did you maybe want to weigh in here? And then Steve, perhaps.
No, I'll let Steve take this one.
By all means, Steve.
So I do think that IASP has not taken full advantage of its position to be recognized as the global voice of pain. And I do think that a lot of organizations see us that way, but there's a lot of competition, and we've not been nearly as publicly vocal as I think we could be. And I do think that public awareness has to be important. Now, how much of it is public versus a member benefit? We'll have to weigh those things. There obviously will be things that we produce that need to go out to everyone, and other things we produce that are of most value to people who are directly supporting IASP, and we'll have to sort of find that line. But I think in general, we need to be more visible. We need to communicate externally much more often. I mean, this is no knock on anyone on staff, but when I joined the organization, we don't have a public relations, public communications position, right? That's a very fundamental thing for an organization. And so we definitely need to step up our external conversations and our external voice. And this gets back to the other issue that was around. There was a question about university programs and education. We need to be the go-to stop for those groups to get information about pain. And we haven't really positioned ourselves or marketed ourselves in that way. And so we definitely need to strengthen that. I do think IASP's future has to be much more vocal and much more externally visible, not just to the pain community in general and our membership, which has largely been what it's been before.
So we had Victor ask a question through the Q&A, and it states, as a member of the Members and Chapters Committee, they're required by the policies established by IASP to disclose certain financial interests and relationships, as I'm sure everybody here is in agreement is a good thing to do. They don't feel comfortable using a certain platform that we utilize, though, the Association for American Medical Colleges. It seems strange that IASP wouldn't have its own department or software for these types of cases, and having to delegate to another organization. Andrew, if you'd like to jump in, by all means, unless you feel that Steve might be a better...
No, I'd be happy to do this. Victor, thank you for asking this. It's something that's very close to my interest, and I've already been very active on this front. Previously, although anybody involved in an IASP leadership position, whether it's on a committee or whatever, was required to disclose their interests, but there was actually no independent review of those processes. And we've now expanded that, so IASP will also have a return as an organisation of what its interests are, and also our staff are kindly doing that. So what we've recently, after an open advertisement, and again that speaks to our increased transparency that we advertise this position through the Committee on Committees, we've put together an ethical review board, and it's great to see Colleen Johnson-Devin and John Norman on the call, because they've kindly agreed to co-chair that effort, and a big thanks to them for doing so. So what they're doing at the moment is to review the disclosures and to identify any significant conflicts that our current processes don't deal with. And they've literally just started that process. They're currently looking at council and the executive committee first. On the issue of the platform we use, that is merely the American, I think it's the American Academy. We're merely using that as a platform, as a third-party provider. It's not that we're using them to review our conflicts. We do that internally or by our independent ethics review board. We're always looking at the benefits of the expense of setting up something in-house, which can be considerable, as opposed to using a third-party provider, which we do in this case. And Steve, I don't know if you want to weigh in on how we choose our provider, or I'm relatively satisfied with them at the moment. But
it's just that it's much less expensive than developing our own. So we purchase a license from them. They don't see any of our data. But a lot of public health and medical associations use their system to get their COI forms arranged and to be able to collect them. It's just they saw a need, they developed their own tool, and they sell licenses to other organizations to take advantage of it. And that's really all it is. It's such a niche product that there aren't really a lot of good places to find that kind of tool.
And as a point of clarity, what Andrew was trying, so I had to look back as well. It's the Association of American Medical Colleges was the outside vendor that is utilized for those needs. I see that we are getting close to time right now, which provides me an opportunity, as we don't have any further questions in the queue, to say that please, by all means, if you've got any questions you'd like to submit or a last minute thought, we'd certainly encourage you to do so. In the interest of keeping us moving, though, similarly as I called out before, and if I recall, Steve, you had an opportunity to respond to this question from this morning. It came towards the conclusion of the town hall, and it was simply everyone in attendance right now is a volunteer leader that spends a lot of time and a lot of energy helping our organization be the best it can be. With that said, the question was, is there anything that the folks in attendance and our other volunteer leaders can be doing right now to help IASP in a tangible way? Steve, perhaps you want to take that, or Andrew, if you want to jump in. I certainly don't want to gatekeep.
I think the thing that you can do the most is provide feedback to us to help us correct any issues that you see. We can't fix what we can't see. And sometimes problems occur with either communications with the organization or implementation of a particular committee or task force. And then we find out about it after the problem has grown. So, being our eyes and ears for things that we can solve or work to help on. And then, it's kind of corny, but you are essentially ambassadors for the organization. And we do need to do a better job of putting information in your hands so that you can articulate what's going on at IASP, what the value is of being a member of IASP. Because I'm sure when people hear that you're working on a particular project or engaged in some committee, you get questions. And people, and I've heard this before, people saying, well, I get questions all the time. Why should I join IASP if they are advocating for joining? So we do need to do a better job of putting that kind of information in front of you. And I do think we do need to have a better set of expectations or things that you could be doing on behalf of IASP. Not that we're trying to force you to do something, but quite honestly, everybody who joins us joins with great intentions and want to be doing all that they can. So we need to do a better job about putting that information in front of you.
It's more of an idea, that question. It's from Victoria. I'll try to work through it quickly. Again, it's speaking towards the structure of the organization. So perhaps this is best equipped for you, Steve. But essentially, the structure of ISP seems rather complex with many different committees, et cetera. And they're cognizant that there's a web page on our website that lists out the committees. But we're curious if perhaps an infographic could be worthwhile to utilize, or an informative version that helps members to better understand what the structure of the organization is.
Just, that's a great idea. And in general, we should communicate with infographic more. It's such a great tool. But yeah, we should create a picture of that complexity. And to be honest, because we're in the middle of it, working with the council regularly and executive committee, sometimes we forget how complex it is to outsiders and how impenetrable it can seem to folks because it is incredibly complicated. When I joined the ISP, I was really kind of stunned at the complexity of the governance, which is how you describe all of those committees and task force and so forth. It's incredibly complex, but it's also indicative of a lot of energy and enthusiasm to be engaged. So it's sort of a knife that cuts both ways, because you want to be able to simplify the complexity so it's easier to explain and see your piece. Everybody wants to see where they are in the matrix, right? You want to simplify that. At the same time, we don't want to simplify it to a point where there aren't enough volunteer opportunities for people, because that's another complaint. We turn away a lot of volunteers, and people get frustrated with that sometimes, and they really want to participate. So we have to do a better job of that. And I think the infographic and just in general communications about the structure is a great idea.
I think that is an absolutely fantastic idea. It would help me a lot as president as well to understand. We have a lot of activities that are fairly internal around finance and administration and governance, and others that are very much member facing. And I think it's important to differentiate between them and to communicate what each committee does. I think one thing I would like to say at the moment, we're trying to be a lot more transparent and open about how we appoint to our various positions. So you may have noticed that we're currently advertising for the WHO liaison. That's an open advertisement. We had a great response to that advertisement. And the committee on committees is quite an important one, because every 2 years, incoming president makes a call for volunteers, and then we allocate people on that process. And most people end up with a role, because we very much appreciate people willing to volunteer their time. And I think it's quite a good opportunity at the moment on that basis to just reiterate that we're currently initiating 3 new activities. We have Johan Vlein is on the call. He, with Romy Parker, is co-chairing our Presidential Task Force on Environmental Sustainability, and you'll see more about that on the website fairly soon. We are updating our animal models guidance for laboratory research, which was last written in 41 years ago. It's a very highly cited paper from Payne, but we need to update it. And then, of course, in January, we'll be launching our global year for next year, which is on pain management research and education in low and middle income settings. That doesn't just mean middle and low income countries. It also means disadvantaged populations in high economic settings. And Saurabh Sharma from Nepal, originally from Nepal and Australia, and Margarita Cava from Chile are co-leading that. And in fact, I'll be in Nepal next week to launch some of those activities. I'm very excited about that. But the infographic is a brilliant idea and helped me get to grips with some of the stuff we do as well.
Definitely.
So, Greg,
Steve.
I know you want to wrap up. I just want to say one thing, which is we're up against time, but this is the first of many of these, right? We're going to figure out the right cadence to communicate with you, whether it's quarterly or a couple times a year, whatever the right amount is to have this communications with the leadership network. And we will do more of these. I think I said at the beginning with chapters and federations, and we will do these, open them up to the entire membership for participation. But we really wanted to start with you because you are the most engaged members of IASP.
Andrew, before I close this down, is there anything else you'd like to add?
No, just thank you for everybody for attending. This is really, really useful feedback. And as Steve says, this will be the first of many, reaching out to different parts of the IASP founders.
We've come to the conclusion of our very first IASP Town Hall meeting. I want to take this opportunity to thank once again Andrew and Steve for being with us today and addressing everything. And of course, I'd like to thank everybody in attendance for sharing the gift of their time. Certainly not last, I want to make sure that I thank Angelo Baselli as well for his help coordinating today's event. This is the first of many town halls we plan to hold as an organization, and we'll be sure to pass that information along as it becomes available. With that, thank you all for being here today. Take care of yourselves and all the best.